I'm your host, Sunita Mohan. We have a great show for you today. We're going to be focusing on diabetes and dentistry. So first of all, in our studio, we have Dr. Arun Narang, dental surgeon and current president of the Academy of Cosmetic Dentistry. Wow,
Thank
welcome
you.
to the show, Arun. That's
Thanks,
great to
Anita.
have you.
Nice
Great
to
to
see
have
you.
you.
Thank
So
you.
our focus is on dental hygiene. And what I want to start off with, so you can, tell our viewers what dental hygiene is and what makes a clean and healthy mouth. So,
Okay. Well, I mean, again, good dental hygiene is the cornerstone of oral health. No matter, all the other procedures that you might want to do to make your teeth look better and whiter
Right.
and restoring the teeth to, full function and good function. But, the key is the health of the gums.
Exactly.
And the health of the soft tissues. If the soft tissues are healthy, if the gums are healthy, if all of the surrounding soft tissue in the mouth, the tongue, the cheeks, and obviously that can get impacted or affected by a lot of things,
Exactly.
a lack of care, in terms of visiting your dentist or hygienist, lack of care in terms of improper brushing or flossing or technique and kind of, doing your home care. And then obviously, smoking or, abuse of alcohol or, excessive use of alcohol or
Right.
again, different risk factors can kind of then emerge also. And there's a lot of studies now that are showing the links between gum disease and heart disease and diabetes and
Right.
stroke
Exactly.
and all sorts of respiratory infections and low birth weight babies for mothers that have gum disease or gum
Wow.
problems. So there's lots of risk between our overall health and our dental health and the health of our gums.
I think that's what happens. I think we ignore our dental hygiene and we think, we don't have to worry about our teeth. We just have to worry about diet and exercise. But I think teeth have a very important role in what our overall health. And it actually tells us, it tells me as a practitioner when I see patients that if their teeth are discolored or they're chipped or they don't look strong, that there's something's wrong, something's going on. So I always ask people when was the last time they went to their dentist and how often do they get their teeth cleaned. So
good for you.
Yeah. No, I do that because I think it's very, like my brother's a
is.
dentist too. So
I'm biased. I'm a dentist. Obviously I'm going to say that, but I really strongly believe that your mouth is the portal of health
Exactly.
for your body.
Exactly.
If you have a healthy mouth and your mouth is going to smell fresh and
Exactly.
the gums aren't going to bleed and the teeth are going to look attractive, and not only that, but it's going to affect and it does affect the overall health of your heart and body.
So let's talk about bad breath, because I know a lot of people suffer from that. So what is that, doctor, what is that a sign of, and what can people do to prevent that?
Okay, well, I mean, it's multifactorial. There can be a lot of different reasons for bad breath. There can be medical, issues that can be causing the bad breath. But from our point of view, what we're first going to try to make sure is that, first of all, that the patient is practicing good home care.
Right.
That they're brushing their teeth properly, not rushing it, brushing more than once a day, 2 or 3 times a day,
Exactly.
at least twice a day, flossing once a day, because if they're not going to remove the plaque from in between the teeth, and any other adjunctive things that you do, like using a water pick or using an interdental stimulator or using a rubber tip, those are all kind of extra things that you can do. But flossing and sort of brushing are key, and also kind of brushing the tongue or brushing the palate or the soft tissues of the mouth, because our tongue holds a lot of plaque, which can create bad breath. So again, so we're going to focus on that, making sure our patients have excellent home care, that they're doing a good job, and that they have the tools to properly, do the job. And if they don't have the manual dexterity or they aren't good enough at it, then recommending an electric brush perhaps, or other adjuncts to make them able to brush better or do better hygiene. And then also, you know, the professional side of it. No matter how well you brush your floss, you're going to need to have a trip to visit your dentist or hygienist to do a proper prophylaxis or get underneath the gum line and remove calculus or tartar that's building up, you know. So a combination of those things, and then beyond that, if someone's still suffering from bad breath, then we can look at other you know, possible causes for that. But a lot of it's from periodontal disease or gum disease, or not good technique in brushing, or not brushing well, or having poor oral hygiene. That's probably the bulk of it. And then there's going to be the 10 or 10% that might be other reasons.
And then you can send them to me.
Absolutely.
The ones there's something wrong, there's something else going on.
Exactly. Perhaps their diet could be, you know, gastric reflux or some other issues that could be causing it, or medical issues.
Okay. So when, like, I always was told that you have to get your teeth cleaned every 6 months, or every people who sometimes have to go actually every 3 months. So what is the good number for people to?
So we always kind of, you know, for your average adult who has healthy gums, like healthy gums, you know, we usually would recommend between 6 to 9 months. 6 months would be ideal, you know, and then, you know, and for someone who may have periodontal disease, recession, or weakened gums, or has gone through, you know, gum surgery procedures, or, you know, has already gone through grafting procedures, or they're going to need to see us more frequently, perhaps every 3 to 4 months, just to be able to maintain things, because gum disease is one of those things, it creeps up on you. It doesn't hurt, and then, you know, you start seeing the signs and symptoms gradually and slowly, and then it leads to eventual tooth loss, or, you know, more serious health problems. But it's one of those things that it has a way of sneaking up on you, and then we want you know, we want our patients to be in a preventive mode, to prevent them from losing bone around their teeth, to prevent them from losing healthy gum around their teeth.
So it's basically when your teeth start to thin closer to your gums. Is that what you mean by gum disease?
Well,
the teeth start thinning, right?
Well, you have basically, the supporting structure is the bone and the gums. So let's say my fist is the tooth. You know, the gums are going to be up here, and the bone's going to be maybe about 2 to 4 millimeters below it. Okay? So we don't want that bone sliding down the tooth. Or we don't want the gum sliding down the tooth. Because if it does, it's going to gradually start to either become more sensitive or weak. The gums is going to get weak. The whole, you know, attachment apparatus for the tooth to make it strong so that it doesn't get loose is going to start to weaken. And we don't want to see that happening. And the best way to make sure that that's not happening is keeping the microflora, or the bacteria, or the germs that are in your mouth, healthy germs. You know, we have healthy germs and we have unhealthy germs. If you put unhealthy germs underneath a microscope, you know, that come from someone's diseased pocket, or, you know, under their gums, you're going to see the type of microflora, the bacteria, can be totally different than the microflora or bacteria or germs that are in a healthy mouth. We all have the bacteria. It's just a matter of what's healthy and what's unhealthy. The unhealthy germs are going to cause much more periodontal disease or destruction of the bone and soft tissues than the healthy bacteria.
And what about toothpaste choices? Because I know now the big fad is to do the, you know, the natural toothpaste, fluoride free. And I remember going to my my brother's clinic, and he said, why are you using you know, that kind of toothpaste that doesn't have fluoride in it? You have to have fluoride. Is that true? Like, what do you say?
You know what? It's a raging we could have a whole show just about the pros and cons of fluoride. And you know, I'm not a proponent of, you know, water fluoridation, like our fluoridation of our home water. I'm not a big proponent of that, because, you know, again, there's been information about exactly what type of fluoride is being used. And, you know, and then maybe we're getting it from too many sources. And could there be other chemicals or, industrial waste that's tied into that kind of fluoride. So yes, maybe there's some concerns about that. But again, if and again, it comes down to a personal decision. Some people may want to use a fluoridated one. Some people may want to use a non-fluoridated one. But that's not going to really affect the health of your gums. It's proper technique. So you could just take a smidge of toothpaste, whether it's fluoridated or not. It's really meant to be just an abrasive, just to remove some of the plaque. And it's really more about how long you're going to brush and how you're going to brush. And are you going to brush all the surfaces of your tooth properly? And are you going to then be able to get in between the teeth and also remove the plaque that's in between the teeth? That will go a lot further than the type of toothpaste that you use, in my opinion. Just proper technique and proper brushing and flossing.
Yeah, I think proper technique is really important.
And proper diet and good
proper
diet.
Because when I go to the dentist and I get my teeth clean, and when they're removing plaque, it's painful. So it's better to do some of the work at home, so by the time you do get your regular cleaning, it's not as painful and there's not so much plaque buildup.
So the plaque is all the soft film. That'll generally build up on your teeth almost overnight. And the calculus, like when the plaque starts to solidify, or calcify, that becomes the hard deposit, and that's what you're kind of referring to as it's a little bit more uncomfortable to take it off. And obviously, if we're seeing you more frequently, there's going to be less of that to remove. So somebody who really does need to be, on a 3 or 4 month recall, and you're going to disturb that microflora under the gums, keeping the healthy bugs there as opposed to the unhealthy bugs, and then also getting rid of the calculus that's building up so we don't get more destruction of the bone and recession of the gums. That'll definitely go a long way to then prevent more gum problems.
Yeah, okay, that makes sense. That makes sense. That's what I want to do. I want to not go through that painful procedure when I go to my dentist. So I make sure that I go regularly, so my teeth are healthy, and good hygiene is really important. So we would love to have people call in, ask Dr. Arun Narang some questions, and also on the other half, when we have Dr. Amish Parikh on, endocrinologist from Trillium Health Center, and he'll be talking about diabetes. So please give us a call in, and we'll be right back with Health Matters. Thank you.